Good afternoon and welcome everyone to the 2022 Virtual Compassion Action Healthcare Conference. I'm Dr. Beth Lown, the Chief Medical Officer of the Schwartz Center, and I want to thank all of you for joining us for this interactive workshop launching a storytelling program to achieve empathy at scale. Please join me in welcoming our presenters. Scott Accord is the Communications and External Affairs Manager at the Providence Institute for Human Caring. And joining Scott is Michael Drummond, Executive Director and Chief Communications Officer at the Providence Institute for Human Caring. Welcome, and we are very, very happy to have both of you with us today. We're really looking forward to hearing about your work. So I will pass this off to you now.
Wonderful, wonderful. Thank you so much. I'm going to share my screen here. And we'll all get started. There's a few moving parts here, folks, so with videos and such. So thank you for your grace. Hi, and welcome to launching a storytelling program to achieve empathy at scale. This session is designed to help health systems plan and launch a storytelling program to capture, curate, and publish patient and caregiver narratives with a focus on sustaining a culture of compassion and what we call empathy at scale, meaning that compassion is found at every encounter in your organization. So this presentation is for health systems seeking to enhance the quadruple aim, that is to improve employee engagement, well-being, and morale. It's also for systems looking to deliver patient care for the whole person, as the industry shifts from volume to value-based care. We're going to drop a few questions into the chat. Our capable folks here at the Schwartz Center are going to be helping us out. And so during this presentation, you're going to see some few questions here and there. We're going to start with, what y'all do for a living. We would love to know what role you play in your respective organizations. Let me see here. Moving on. Well, we've done introductions. I'm Mike Drummond. I'm here with Scott Accord. But before we get into it, we thought it would be illustrative to begin with an example of our storytelling program. We're going to play for you an edited clip from our collection. It's 3.5 minutes long, and it's called A Kitten for a Dying Man. I'm going to slip out of PowerPoint here and play this video. I beg you for your forbearance here as we make that shift. Okay, share screen, and here we go.
I knew at 5 years old that I would be a nurse, and I never changed my mind. So I feel like my nursing actually was a God calling. And in fact, I guess I've put my own little life label on it, and I call it more than a job. And then as I've gone through this job during my life, so many things have happened that has reaffirmed to me that it's more than a job, that my nursing is actually a ministry. It's meeting people's needs. I was supervisor on a general surgery unit, and we got a patient in named John, and he was transferred to us from Seward, from a nursing home, and he had terminal cancer and he was dying. He had befriended a stray cat that would come to the porch, the veranda of their nursing home in Seward, and he would feed it. So when he had to leave down there to come to Providence, one of the staff there cut a picture out of a magazine of just some cat and gave it to him. So when he came to us, it was clutched in his hand and he would not let it go. And I thought, man, this man has nobody and he's about to die. So I told my staff, I said, I think we need to plan something here. I said, John needs a cat before he dies. I knew I couldn't bring my cat in. She was big and elderly. But my neighbor had a little kitten, wild little kitten. But yet it was small enough I could sneak it in, I think. And so I got here and went on in the room, and several of my coworkers went in the room with me. And I said, John, I brought you a visitor. And he looked around and he didn't see anybody other than the staff. He said, well, who? I don't see anybody. And I said, here. And I pulled the kitten out of my satchel and set it on his abdomen. And again, I'm praying, Lord, please don't let it get wild. And John looked down on his abdomen at the kitten. I can see it to this day, and we're talking 30 plus years ago. That kitten walked up John's abdomen to his chest, touched noses with him, and laid down on his chest and looked in his eyes. And John started talking to the kitten. John cried, we cried, the kitten purred. And for over an hour, John and that kitten communicated. And finally, I had to leave, and I said, well, John, I've got to go now. He said, well, thank you. And then he thanked the kitten for coming. And again, the kitten touched noses and kind of purred and rubbed against him. And John handed me the kitten back. And I left in tears. Aww. And John died the next day. And I look back on that, and I think, my God, all the nursing care in the world wouldn't have done for him what that 1 hour with a kitten sneaked into the hospital did. And again, that just made me see even more. That's what it's about.
I love that clip. All right, I'm going to try to find us. Let me see here. Okay. Going to get us back to our presentation. Very good. Y'all with us here? Okay. All right. We're going to be moving on. Okay. So sometimes in healthcare, you know, it's more than just medicine. And one of the things that among the many things I love about that particular clip is that the closed captioning or the text allows it to be accessible to the hearing impaired. And so inclusivity is something that we really strive for in our program. A little bit about the program. Hear Me Now is a creature of the Institute for Human Caring at Providence. It's one of the nation's largest health systems. And the Institute seeks to make healthcare more personal, less transactional, by leveraging palliative care, technological innovation, and caregiver and community engagement. All of this can be found on the website, instituteforhumancaring.org. Hear Me Now's mission is to make healthcare more humane, simply put. We do so by inviting caregivers, providers, patients, their loved ones, and communities to record and share their stories. We're all about offering a platform to be heard and understood. Hear Me Now was founded in 2016, was adapted from a model developed initially in partnership with StoryCorps. And it's been customized for the unique needs of healthcare systems. Hear Me Now uses traveling story kits to conduct recordings. They kind of look like overnight bags. And they're like 40-minute sessions, typically between two people who know each other. Since the pandemic, we also incorporated a digital studio so we could record remotely and safely. It's kind of like a Zoom environment with a few more bells and whistles. Hear Me Now staff and volunteer facilitators have collected to this date more than 500 recordings from Anchorage to Anaheim. And as far as we know, this is the largest such medical narrative collection of any health system in the nation. Many edited clips live on the Hear Me Now website, and these clips are used for community outreach, philanthropy, relief of employee fatigue and burnout, media pitches, reflections, recruitment and retention. With participant permission, recordings are archived in the American Folklife Center at the Library of Congress, something that we like to call love letters to posterity. and all participants get a digital copy of their recording. Currently, Hear Me Now is operational in 10 areas across the 7 states. Providence operates, Anchorage, several sites. Actually, Anchorage was our first site. Several sites in California, Missoula, Montana, a couple sites in Seattle, and prior to the 2020, and in 2020, just prior to the pandemic, Portland, Oregon became our latest Hear Me Now site at Providence. And we're always interested in expanding our territory. We're currently looking at Lubbock, Texas, and Spokane, Washington. They're on our short list. And before we get into the nuts and bolts of this presentation, just one more note. Many clinical studies attest to the benefits of storytelling and listening for patients and providers. These are just a few. Storytelling has helped increase immunization efforts. This is from the South Dakota State Medical Association. Very important during a pandemic. Storytelling enlightened medical school students on empathy for dementia patients. This comes to us via the Penn State College of Medicine. And then finally, the journal Cancer Nursing put out a study showing that cancer patients receive something very precious through storytelling and listening, and that is hope. Here comes another question for you all. We could put this in the chat, the team at Schwartz there. What are the biggest challenges facing your healthcare organization? We're kind of interested in knowing that. Are they financial, hospital-acquired infections, recruitment, retention, or other? Feel free to pick all that apply. All right, cool. Let's dive into what you'll need to know to start a storytelling and listening program at your organization. I now turn the mic over to Scott. Scott, please take it away.
Thank you, Mike. Hello. So I'm going to be talking about the nuts and bolts here and little peek under the hood. As with any program, you want to know your target. What are your goals? What do you hope to achieve? An easy way to incorporate your storytelling program is to align it with your organization's strategic vision and priorities. One of the many ways in which we were able to do this is by working with our senior leadership to solicit and record stories from nurses. We did this as a means to honor their work and for recruitment and retention. And then recently, a health system out of Canada sought us because they had a couple of issues they wanted to address through storytelling. The first was to help deal with moral duress among its pandemic fatigue clinical staff. The other was to reflect upon the historical injustices visited on the indigenous population in their region. So if you know your target, you can look for the stories and storytellers to help you accomplish your goals. And then in addition to knowing your target audience, and to knowing your target, you want to know your audience. Who do you want to experience your recordings? Are they for internal consumption, or are you interested in reaching the public? If it's internal, you can get away with jargon and medical terms, but not so much for a general population audience, or if you want to reach current or prospective patients. You'll also need to find a home for your program. If you're mission-driven, it might make sense to have mission or a spiritual team own your storytelling program. In our case, the communications team owns it. And while you're likely to want participation from providers, we don't recommend the clinical departments own the program. They have enough on their plate, and probably with few exceptions, running a storytelling program isn't their area of expertise. When it comes to recording your stories, you're going to want to use dedicated recording equipment and/or an online recording platform. We don't suggest you use personal smartphones. Too many things could go wrong. You don't want to have patient stories living on a personal cell phone, for instance. It's safer to have dedicated recording equipment. And if you're worried about cost, you can get digital recorders for under $50. We use both high-end digital recorders like the one you see here. and an online audio-visual or online audio-video recording platform. We were also able to find mothballed laptops. We had them stripped down just so that we could use them for the Hear Me Now program. And we did this so that we could ensure our stories are safe and secure. Once you have those in place, you're going to need a dedicated staff of at least one, and then a team of volunteers. This is an image from one of our volunteer facilitator programs, our trainings in Portland, Oregon. Mr. Rogers famously said, "Find the helpers." Well, we found a dear friend with the system's chief librarian, and then later the chief nursing officer, the chief mission officer, and other C-suite leaders and frontline workers. Then you'll need to draft policy, instructions, brochures, and other supporting documents for your program that are consistent with your organization's values and strategic priorities. And most importantly, consent or permission forms. We were able to clear our program through our legal department because we have a robust and tiered permission form system. Because patients give their permission, we're clear when it comes to HIPAA compliance. Then if you're going to make these recordings available to outside audiences, that is anyone other than the participants, you're going to want to edit these recordings. We use several contracted audiovisual editors, but you can find cost-cutting ways to edit your stories. For example, you could seek partners at a local community college. Maybe they could edit for school credit. The downside, of course, is matriculation and turnover. One of our Alaska facilities partnered with the local NPR affiliate to edit and air their recordings. And one of the tools I find most important is a system for curation and archiving. And that's because we have over 500 stories. We adopted a name filing convention from StoryCorps, and we have a dynamic conditional cloud-based spreadsheet with links to full and edited recordings with keywords for easy retrieval. It may be a bit of an eye chart, but it's also a thing of beauty up close. And it allows us to find any story with just a few keystrokes. One of our patient experience experts developed this spreadsheet, and it includes story subject categories such as health equality, organ transplants, palliative care, hospice, mental health, maternal health, nursing, LGBTQ+, philanthropy, and even Holocaust survival tales, among others. Here's a look at that table of contents with a list of our intentional story collections. This will give you an idea of how easy it is to navigate and find stories. Lastly, now that you've built it, share it. Make it easily accessible for people to find your content. In our case, our stories live on our website. They also get used in our podcast as well as bonus material for specific episodes. In fact, our Hear Me Now storytelling program has become so successful. We are 1 week from launching a beautiful new website built just for Hear Me Now stories and the Hear Me Now podcast. Our stories also get used for internal and external newsletters, social media accounts. You can play clips for reflections or to start meetings. And you can get these stories out via internal presentations and at community events. One of the things that we do is we partner with our philanthropy teams to help them collect and share stories for fundraising. Our storytelling program has now been integrated into every department within Providence, including our annual reports and various campaigns. And I'm sure your social media and website teams are always looking for content. Authentic stories make for great content. Now you may be asking,
How about that for a segue? Scott, you did a great job. You should consider doing this for a living. Now you may be asking, how much does this cost, right? Well, as Scott had said, this is going to depend on your goals, of course, but here are a few broad guidelines. You'll want to devote at least part of an FTE, full-time equivalency employee to oversee the program. Someone to whom the program's accountable, right? And you're looking anywhere then from, in real dollars, $20,000 to $250,000 for all or part of the full-time staff person. Again, you can get digital recorders for under $50. The high-end recording kits of the type StoryCorps uses run upwards of around $3,000. And editing can run anywhere from a few $100 to nearly $1,000. But as noted, there are opportunities to partner with local radio stations or colleges to offset these editing costs. You may even have someone on staff who's literate with Premiere Pro or some other editing software. And creating and maintaining a dedicated website can be done on a shoestring or contracted for larger amounts, of course. So all told, you're looking at anywhere, like I said, between maybe 20,000 to upwards of 250, mostly reflecting that mostly would reflect an FTE salary though. The costs on the lower end, I think we could argue that are in range for most health systems, I guess in normal times. And finally, you also may be asking, where's the ROI? What's the return on investment? Again, it's going to depend on your goals, but here are some suggested success metrics that we've used. Patient satisfaction surveys. You can consider customizing surveys with Press Ganey as a way to measure your storytelling program's impact. There's provider engagement. Testimonials can be really potent yardsticks. There's also publicity value. Just last week, a site picked up one of Providence's blog posts featuring Hear Me Now clips on nursing. According to Cision, that's a media monitoring company, that single post was valued at nearly $4,000, calculated as a cost it would have paid to get that content posted up there. Finally, there's recruitment and retention. And I know that's a pretty heavy issue right now, at least at Providence. You can work with your HR department to measure the impact participation or exposure to your storytelling program had on incoming, current, and outgoing employees. On this last point, let me share this insight from our own human resources experience. If a newly hired clinician leaves Providence when they're the first year, that costs our health system 2 times that clinician's salary based on talent acquisition, training, and other associated costs or other costs associated with onboarding a new employee. So as a nurse, say a nurse, for example, who is hired at $120,000 a year, and that person leaves within the first year, it would cost us $240,000 if they left within the first 12 months. So it pays to retain, it pays to retain talent. And having a program that shows that you authentically value your employees can help improve retention and avoid costs related to turnover. Here's another question we want to put in the chat before we wrap up and get to our Q&A. Based on what's been presented so far, do you think your healthcare organization is culturally ready to engage with a storytelling program or listening program? That's a yes or no question. All right. So we spoke a moment ago about the potency of testimonials. Here are just a few we've collected. I'm going to allow you to absorb those, and I'll speak over these testimonials. They're pretty powerful, though. As Scott had mentioned, today, Hear Me Now enjoys widespread support from across Providence and has become the centerpiece of employee and patient engagement strategies in many service lines, including home and community care, human resources, mission, nursing, philanthropy, and population health. Speaking of population health, we wanted to share this story. So after the George Floyd murder and social unrest, we asked 2 Black employees to share their raw experiences with racism with us. This was in 2020. And this session was our first Hear Me Now podcast. That's now our sister, the sister program of our Hear Me Now storytelling and listening program. Senior leadership has told us and has announced publicly that podcast episode motivated Providence leadership to launch a 5-year, $50 million health equity campaign under the guidance of Population Health. So that's a pretty powerful testimony and testament to the embrace of storytelling and the cultural affirmation that this program has allowed. So we would love to hear and work with you on rolling out a storytelling and listening program at your organization. And we wanted to thank you for your time. And now we open up the session for questions and discussion.
It's fantastic. Thank you so much, Michael and Scott. I think that there are some questions in the chat. And one of the questions I had is, are all of these just free for the download, or for the viewing to the public on your website? Which I assume the answer is yes. Is that correct?
I'm sorry, could you rephrase that question for me? I'm sorry.
Yeah, these stories can be accessed for free on your website. Can they be downloaded or shared or no?
Yeah, so yes, they all can be accessed. We initially had them, they didn't have the download functionality, but I think on our new website, and Scott can correct me if I'm wrong, under our new website, users will be able to download those.
Yes.
The answer is yes.
The answer is yes, and we're free to show it or use it?
Yes, absolutely.
Or not for non-commercial purposes, I would assume. Yeah.
Absolutely, yes. Yeah.
Terrific. Thank you.
Mhm.
I'm just looking at some of the other questions. I'm not completely sure.
I see one right here. How were patients and families invited to participate?
Yeah.
All kinds of ways. We do active solicitation. We have a robust team of volunteer facilitators, across 7 Western states, and they're constantly on the make for listening to stories. And Scott, you can maybe amplify a little bit about how we get some of our stories.
Yeah, I mean, it's through pitching.
Right.
It's through constant pitching where we talk up the program to various department heads, and then we reach out through their teams to see if we can get, whether, like, say, if it's for a hospice patient or their families, we'll work with the hospice teams to see if they have stories that somebody might like to share.
Yeah, and so it's interesting. That's a really cool question, because when I first launched this back in 2016, I was pushing the program. We were pushing the program on people, and now it's being pulled from us so much. So we're at the point where we have to not say no, but not now. There was another question in here from Jane Raymond. Not sure if I missed this. I missed it.
Is there a way to?
Oh, active listening skills. It was a. Do you review active listening skills and collecting stories? Yes, that's so cool. So episodically, during a few times during the year, we host storytelling seminars, internal webinars, specifically training people on active listening and identifying the components of compelling storytelling. When we first started, there was a lot of life review stories. They took us on these long, winding journeys, which were fine, great. But I don't know, a couple years in, we decided to kind of coach people on how to wrest the most compelling stories and anecdotes with discernible beginning, middle, and ends, with tension and resolution, those kind of elemental storytelling aspects that make for a more compelling listener experience for those who aren't participants, right? So I'm a recovering journalist. I was a print journalist for like 20 something years. Scott's formerly with Viacom. So we have storytelling kind of built in our professional DNA. So we like to share that experience and that expertise with others across the enterprise.
Thanks, Mike. There is I think this was your question to the audience, asking about, is your healthcare organization culturally ready for a storytelling program? Do you want to speak to that? and what would
Yeah.
help someone know if they were or were not?
Yeah, well, we knew it when the CEO in Alaska cut us a big fat check to StoryCorps. So we knew it then, but it took a little bit of, because we come from the a palliative care place and the home and community care world, there was a lot of receptivity to storytelling, particularly among the chaplains and the social workers, particularly. That was the low-hanging fruit for us to get those folks involved. And so it became culturally adaptive to come through a place that was already receptive to storytelling and active listening, right? So it took a little bit of education, patience, and a lot of perseverance.
Can I just clarify? So you said someone wrote a check to StoryCorps. What is your relationship to StoryCorps? What is this program, and how do those two?
I'm sorry, I guess I blew right past that one. Yeah, StoryCorps is the nation's largest, oldest like storytelling oral history project. We partnered with them because we wanted to launch a storytelling program, but we're in the woods. We didn't know where to start. Dave Isay was very good friends with Dr. Ira Byock, who happens to be one of my close friends and also my boss. They got into a conversation. They said, wouldn't it be great, because we're all about caring for the whole person, if we involved, if we added narratives, patient and provider narratives to that experience. And so that's basically how that started.
So, but is the relationship still ongoing? Are they your funding partners?
Yeah, it's not a fiduciary relationship anymore. It's not a contractual relationship, but we're in regular contact with them, and we always seek to find ways to do something here or there. Like we did like last year or 2 years ago, we did a storytelling seminar with the aforementioned Dr. Byock and Dave Isay. So it's a love relationship rather than a contractual relationship.
Got it. Okay, I didn't quite catch that.
Yeah.
Let me just look at what else. Somebody wanted to know where the data came from about replacement costs for nurses, I think.
Oh, the data comes internally from our home and community care's chief person officer, human relations person. I contacted him and asked him if there were any data on that, and that's the data that he shared. Right.
Okay. Thank you.
You got it.
So, and then somebody else asked about whether you have to pay to partner with StoryCorps annually in order for the stories to get into the Library of Congress. But I think you responded that you no longer have a fiduciary.
No, we don't. Yeah, no, but but because of our legacy relationship with them, all of our recordings are still archived in the American Folk Life Center at the Library of Congress.
Yeah, fantastic.
Yeah.
So I'm just curious if there are more questions from our listeners. One person, I do see one more. Do you do any storytelling or listening, I suppose, in the long-term care setting? And I think that first story about the kitten, was that in long-term care or hospice? And
he was, if memory serves, he was a patient in an acute care center, but then moved to a long-term care facility.
Right. Yeah. Okay. Yeah. Thank you.
And yeah, we intend to come back, and we intend to go back to Mount St. Vincent in Seattle, which is a skilled nursing facility meets preschool, and it's a pretty fascinating dynamic there. And yes, we love doing stories at long-term care facilities.
This is a wonderful question that we received. One of our listeners is saying, I am hearing that there is value for both the story sharer and the story receiver Have you found a way to capture the qualitative impact of this program? It's a great question.
It's a great question. You know, we're looking at ways to work with our data analysts and our data scientists on ways to getting kind of a real egghead numbers generated ROI on this. Right now, we are just collecting and into that beautiful spreadsheet that Scott had showed you. Right now, we are just collecting these testimonials, but that's the next step, is to look at ways to really kind of quantify this through the data analytics metric. Yeah, we haven't done that yet.
And the narrative analysis of what people have to say, you know, about the program and their participation in it. So wonderful, wonderful. Thank you. So any more questions? We're open for the remaining questions before we close out the session. I think it's been amazing and very, very important. I know I personally look forward to StoryCorps every Friday morning here in Boston.
Nice.
Make sure I hear it, you know, and of course then everybody's, you know, crying at the end of most of those.
Yeah.
And so is it possible for people to reach out to you if they have questions about how to do this at home?
Absolutely.
Wonderful. Right.
Yeah, we've got our website is right there, and there's a place to contact us on that, and we have our phone number right there too.
That's wonderful. Thank you so much, and thank you for sharing that absolutely beautiful story at the beginning.
It was our pleasure, and thank you all for your time and kind attention.
Yeah, well, we appreciate it. So thanks everybody for listening in, and hopefully you're leaving with some fresh ideas about how to do this at home. We really appreciate everybody for being here with us for this presentation. We want to thank our national business members as always for their support. We're going to take a 15-minute break, and then please refer to your attendee hub to select your next session. Thank you, Mike. Thank you, Scott. Thanks to all of you. Enjoy the rest of your afternoon.
Thanks.